I mean, I will too.
I get to be there with my sister and my young niece.
Good for you. Congratulations. I hope you have a great time.
Okay, just so everyone is aware, we are live streaming
Rotator.
and Chambers is unmuted.
Thank you.
Chambers is now muted.
Taking 3 weeks off.
I'll be in hopefully.
Anything, let me know. What I've been going.
Yeah, can I ask you?
Pretty good.
Let me ask the attorney a question. How come everybody's getting old except Mike and me? Oh, is there an answer to that?
Yeah, there's an exclusionary clause.
Okay, good. Now we know, Mike.
Yes, right. Yes, I hear you.
Okay. Oh, poor guy. He's doing better though.
Elaine, you're so funny. Come on, you just right in front of you and you're looking everywhere.
I did it last night and she's looking.
And I'm behind you.
Holy cow.
Oh, the Pledge of Allegiance. Thank you, Heidi.
It's like an echo. You don't know which way it's coming from.
Yes, we're trying to.
There's Aileen. Okay.
Yes.
See if I dare to wait back.
Great.
Okay, maybe we can start. We have a quorum. Okay, I'd like to call the Health and Human Services Committee meeting to order. Elaine McNabb Coleman is participating remotely. And Heidi's here, Brian's here, Mike's here, myself, Lydia, and Christina. Can we start the meeting with Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, on the Health and Human Services Committee meeting tonight, we have well, first I'd like to get a motion to approve the minutes from January 12th.
I'll move it.
Second.
Okay, all in favor? Great. We do have one appointment tonight for the Office for the Aging Advisory Board, Betty Mate from Martville. I'd like to entertain a motion for that appointment.
I'll move it.
Second, Nightingale.
Okay, all in favor?
Aye.
Right, no one opposed, great. Tonight on the agenda, we have a total of 18 resolutions for this month. HH 16, you see, has been pulled, so that leaves us with 6 resolutions from the Health Department, 6 from the Department of Social Services, 3 from Mental Health, 1 for OFA, and 1 for the Youth Bureau. If I could, I'd like to start with the Office for the Aging Resolution, HH 17, get that one out of the way. Nicole Cerudis is online and she's here for Brenda. She's filling in for Brenda Wyman. And the one resolution, I did speak with Brenda about this, is authorization for the chair and the director of the Office for the Aging to enter into a contract for 2023-2024 for the expanded in-home services for the elderly program. That's the ISEP program with the licensed agency Staff Kings. As you can see, this is not the first licensed agency who, after we passed the resolution in January, has asked for an aid hourly rate increase. So this particular resolution offers a series of rate increases that Staff King is proposing. A lot of it has to do with the difficulty of providing aids and providing the service. Brenda wanted me to inform everyone that she does not see this being a huge impact to the budget. There's only 5 clients currently that Staff Kings is serving from in the ISEP program. And at no time will the county go over the amounts of money given to them by the state for this ISEP program. And the number of years, they have not expended all of the funds anyway. So, you know, in an effort to try to get as much aid service to people in this community, she's asking for this resolution to pass and these increases in hourly rates to be approved.
Go move it.
Clark will second.
Any questions on that? Go ahead.
I just wondered if the elder adults had to be Medicaid eligible for this program.
The ISEP program is for people who do not qualify for Medicaid. So they're income eligible, but if you qualify for Medicaid, you go right through the Medicaid funding. This is a separate pot of money for lower income, non-Medicaid eligible clients.
Perfect. It's very unmet need. There is a gap between,
Yes.
I think a serious gap between.
And paying out of pocket for aid service if you have not much income is very difficult to do. Yep. Any other questions? Okay, all in favor?
Aye.
Aye.
All right. Thank you, Nicole.
Thank you.
All right. If we could go on to HH 18, which is the one resolution for the Youth Bureau. And Debbie's here tonight. If you want to come up and kind of talk about this, this is funding that the first time she's asking for permission to use some of the $250,000 ARPA funds that we passed over to the Youth Bureau. Lynn told me or told Deb that she has already in 2023 moved those funds into the Youth Bureau budget. So that's why it, and into this particular account that's being referenced. And this is really to look at startup funding. I think it's rent for 2 years for this youth drop-in center that we talked about. So if you'd like to, kind of give any more update, that would be great. If I can get a motion for HH 18.
I'll move it.
And a second. Okay, go ahead.
So HELPRA is a new organization here locally, and I have met with the person in charge of that group, Jason Myers-Wally, and he has decided there's a need that we all are aware of locally for a teen drop-in center. So he's decided to utilize the 2,000 square foot of space that he currently is renting at the Carr Building just down the road for LJ's Safe Place. It's a youth drop-in center where there's going to be activities. He already has a lot of recreational equipment donated. He's doing a lot of planning, kind of emulating some of the other drop-in centers around the area. So he has a really great plan. He has some youth members already helping him with a lot of the planning. And he's actually putting an open house together on Saturday, May 4th. We're looking at the time for that, but I will let everybody know because I'm planning to stop in and you'll all be invited as well. I think it'd be great to show our support. So just for some seed money to get his project started with the ARPA funding, we had spoken and discussed doing rent for that particular 2,000 square foot of space for 2 years. We would enter into a contract with him, pay that rent quarterly to him. When I work with the county attorney on doing that contract, we would revisit how everything's going with our contract quarterly, just to see how things are going and make adjustments if needed.
Right. Heidi, whichever.
Oh, thank you. Help LLC, is that currently a private business, and are there plans for moving this to a 501c3?
Yep, he does have a plan ultimately to move that to a 501c3, would like to get he's just starting everything up. So ultimately he'll need funding for that as he goes down the road, because he would be able to get some other grant monies for that as well. But right now he's operating that as an LLC with LJ's Safe Place as the DBA.
Okay, thank you.
Right.
I just want to say, I'm fully in support of this project. This is why we have a youth bureau director, and this is why we have Wally in our community. I think this is well needed, and anything that I can do to support it, please let me know.
Okay, great.
We may have some stuff we can donate, which I've talked to Wally about, but also any type of fundraising and stuff I would like to be part of.
Okay, great. He's very excited and passionate about it. And I can see that just talking to him, and a couple of times I've met him, and I'm excited to be a part of it too. I think it's a great idea.
Yeah, this is good for our community. So
Lydia? Thank you very much. I really am glad that we're running. Yeah.
I do have some questions.
Okay.
Did he present a plan as to what hours would look like, what projects or plans are? And do we also have some sort of a schedule as to how we're going to be releasing these funds that he's made you aware of?
So the hours are right now proposed. He did put a proposal together for me. So the hours are going to be Monday through Friday from 3 until 10 p.m. And he's going to adjust that based on where the need is. If people are kind of leaving by 8 o'clock, he can make some adjustments there. And on Saturdays from 11 to 5, same thing, make adjustments based on the need and the individuals coming in. As far as the payment, I have met with the county attorney. Once we get the payment plan together, I'll be working with the landlord of the car building just to get any type of receipts of whether we reimburse Helpra for the rent or we do the invoicing through the landlord of the car building. That's something that we'll discuss the best way to do that. But we are just going to release it every 3 months or so, nothing all up at once, nothing. The $30,000 isn't going to go all at one time.
Excellent. Thank you very much. Any other questions?
Elaine, I have a comment. I just want to thank Deb for what she's been doing. You've only been here a few months and you've done a great job. I want to thank Lydia and Heidi. According to the bylaws, the chair puts 2 legislators on the board, on the youth committee board. And Lydia and Heidi accepted, and I really appreciate you both standing up. How are you coming with the youth? I know there's supposed to be a certain amount of youth on there too. How are you coming with that?
Good. We have 2 youth right now and we're
Great.
working on a third. So we have enough of the youth and then we will have a third one that I'll be forwarding the appointment on to probably within the next week.
Great. I echo what Brian said. This is needed for a long time in our community and I appreciate y'all. Thank you.
And, I echo Deb that there is no doubt in my mind about the commitment from this young man in terms of trying to make this work. And yeah, I think his intentions are great and his work ethic and his commitment are certainly there. So.
Great young man.
Right. I'll also say regarding Jason, he's very well networked. He has a real handle on the pulse of young people. And I think he's going to be a great role model. And I think his personality will help bring in staffing and volunteers. My early days of being here in Auburn was running a community center with teen drop-in. And I know staffing is everything. They're looking for mentors and people to be around, not just activities. They want to talk and hang out with trusted adults as much. And I think that Wally has the networks to make that happen.
Great. Okay, thank you very much.
Thanks, Tim.
All right, that's great. All right, let's go to the health department.
I might have missed it, but I didn't hear an all in favor.
No, she's right.
Okay, all in favor?
Aye.
Any opposed? Thank you for keeping us honest.
That was Elaine.
That was Amanda.
Amanda was.
Yeah. Yeah, Aileen's not, she's not taking the minutes. Okay, Kathleen, you have, maybe we could start with HH1.
Sure.
Okay, to create and fill a public health engineer position in the health department.
Correct. This is a request to fill a position, to create and fill it. Part of the discussion I'd had last month, we anticipate a vacancy within the next couple weeks of the person in this role. We want to backfill it because the vacancy is a leave of absence for a number of months. It's our hope the individual who is going out on leave will come back and help be part of the succession after our current environmental health director retires. In order to hire someone, start orienting them, we need to create the position so that we can attract the person with the idea of it being a long-term position and the benefits that go along with that.
And if you don't mind, Kathleen and I had talked initially, there is not any intent to have 2 public health engineers working at the county health department. The current public health engineer is going on a leave. The majority of that leave will be unpaid. And if you just, I initially thought she would create a temporary position behind the medical leave, but if she was to advertise it as temporary, there would be no benefits. And for the first 6 months, which in essence, it's going to be difficult enough to fill it anyway. So to have it with no temporary, with no paid time off or benefits would be almost impossible. So it's clear in the resolution that this newly created position will be in force until the leave of absence is over or until the position is no longer encumbered. So, again, there'll be one public health educator. This is the best way you can think of to fill behind.
Correct.
Gail, move it.
Clock second.
Question.
Yes, certainly.
I know that you said that we're not going to post this as a temporary position, but that information is obviously going to be disclosed to folks applying for this, right?
It's not going to be a temporary position. If the plan works accordingly, it will be a full-time position, assuming. But so to your point, yes, we would be honest and say they'd get bumped if the incumbent came back and did not want to accept a promotion, then yes. I don't anticipate that happening based on current conversations with the incumbent.
So if the incumbent comes back, they're going to get promoted.
Yes.
Because of the retirement, the impending retirement of the environment of Eileen O'Connor.
So lots of moving parts.
Yes,
Lots of moving parts.
So you're lucky that you did this through a succession plan and you actually like the candidate that you brought in as entry level.
Yes.
Because it sounded good when you presented it, but I'm like, well, if you get the right person, but it looks like you might have.
She's doing a very fine job.
Thank you.
Okay. We get a motion a second. Do we do all in favor? All in favor?
Aye.
Any opposed? Great. Okay, how about we group together HH2 and HH3 because, and then we'll get a motion for them, but they're both filling fully budgeted positions.
Yes.
I'll make the motion for the bundle.
Second.
Okay. You are asking for the children with special health care needs to have a 4-week or so.
And overlap. We have a retirement for the coordinator position. We are fortunate. I think we've got a good candidate internally that we hope to promote into that role, but we need to definitely have some crossover time for orientation purposes.
And HH3 is you had a recent resignation of a junior accountant.
Yes, we went and had a promotion within the county. So we're glad for that individual, but we certainly are looking to fill the vacancy created with her moving to another department.
And that's this month coming.
It's tomorrow is her
Oh,
last
yeah, okay.
day. Yeah, tomorrow is her last day. Yeah.
Okay, any questions about HH2 or HH3?
I thought the bundle was 1 and 2. It's 1, 2, and 3.
Yep, we already voted on
No, we
one,
already did
just
one.
2 and 3 we can do.
Did 2 and 3.
Okay, all in favor of 2 and 3?
Aye.
Any opposed? Okay, HH4. Want to go over the request to fill a principal account clerk position and vacate a senior account clerk position, moving someone from a grade 10 to a grade 14, or that's the goal?
That's the request. We have a person within our accounting division who is taking on duties that are appropriate for the principal account clerk position. With the vacancy of this junior accountant position, we will be asking more of this role. Additionally, we know that this individual is capable, has taken the test, and actually is reachable to us on the civil service test. I know I shouldn't use this as an excuse, but we aren't fortunate enough to retain her within our department. She will absolutely take a job in another department because it's better for her. But legitimately, there's the work that needs to be done at this level. We do have the money within our department and wish to upgrade this person's position. It's about 1,100 difference.
From step one. And
Correct.
and you'll fill the principal account clerk and vacate and unfund the senior account clerk. There's no discussion of backfilling.
It's not an additional person, right?
I'll move it for discussion.
Nightingale second.
Okay, questions? Okay, any problems? All in favor?
Aye.
Opposed? Great. This is enter into a contract with your hearing officer for the Board of Health hearings.
Correct. Yes. They requested a slight increase for cost of living and they do a great job. So we would like to accommodate that. Going up from $45 an hour to $48 per hour.
Okay, and that's the hearing costs and the hourly rate for preparation.
Correct.
Okay, can I get a motion for HH5?
I'll move it.
Second?
Second.
Okay, any questions about that?
Question
Okay.
budgeted, right?
It's budgeted, yes, we can absolutely stand it, and we also get state aid on that roll for expenses. Thank you.
Okay, all in favor?
Aye.
Aye.
All right. Okay, the last one is to amend a current contract you have with McGinnis and Associates. And my understanding is it's moving from $700 and some odd dollars to $900 and some odd dollars because you're adding additional software for the billing component and going paperless.
Correct. So this is something that we did put in the budget with the hope of being able to amend the contract we have with McGinnis. McGinnis is the billing software for the preschool special education. I know we've had some limited conversations about that. It's a very complicated process. But this additional portal, the CPSE portal, it's called Children Preschool Special Ed Portal, will allow for the therapy providers to enter all their information electronically into the system, thereby not only saving actual paper, but it also should save our staff time in going back and making sure, did they include everything? Did they not include everything? Are they missing things? Do we have to send it back? So it'll be more efficient for our staff. It'll get payments to the providers in a more efficient manner as well. So that's our intention.
Yep.
Is it 700, like annually or monthly?
Monthly. It's a month.
Okay,
I'll move it for discussion.
Nightingale.
All
Second.
right?
too late. I ain't got my
She's a rule
I'm a
follower.
rule follower.
quicker with
Go
me
ahead.
because I'm gonna put my question out before you get a chance.
I'm curious about the software entry ability and the retention of the information and its shareability once a child moves beyond preschool to kindergarten and districts. Are they legally, can they access the data, and are they legally able to access the data?
The healthcare providers or the schools?
The schools, once those preschool children go into public school?
I don't know that answer. I can tell you, I know that there are meetings where discussion of this child, at the transition meetings, when a child goes from preschool to kindergarten, if they're going to continue on with special services.
There's a special meeting for that, right?
Correct. But I'll try to find out. I don't know.
Thank you.
Any other questions? Okay, all in favor?
Aye.
Aye.
Well, thanks. Yeah, okay. I think you probably saw, we're talking about our transition still. I will actually be coming back next month with a few more shells that we're moving along to try and accommodate the needs of the department. We had really good feedback. One of our public health fellows is a graduate of Nazareth College and stays in touch with their teacher there. The teacher, there's a public health lesson that needs to be taught. I don't know if it's a class. And our fellow and one of our health educators presented to that class the other day. It was really well received. And we're very glad for those kind of connections, not only to share what public health is, but we often get great interns. This person who's a fellow had been an intern from Nazareth College also, and she's really excellent. Speaking of which, our fellows grant was extended through 2024. So we're very pleased for that. It's not an increase in funding, but because of the time it took to get the program off the ground, this will to extend the work of the fellows for nearly another 12 months. So we're very pleased about that. We attended the local emergency planning committee. I expect to probably hear about that through emergency management, but that was good to come back together. For those of you who are familiar or not, it's primarily first responders, but it's local emergency planning, right? There's planning for hazardous materials. There's plannings for drills that need to be done by various municipal entities. And in our case, for example, we have drills for public health preparedness that this group often helps us with also. So it was a good group to get together, a lot of new faces, but a lot of more experienced people too. And then I wrote down a few things, some of the proposals in the governor's budget for the forthcoming year, a few highlights that would impact public health if everything goes forward as being spoken about. Now we know there'll probably be changes along the way, but lots of information on lead and residential inspections that I'm not accurately reflecting this, but it would require property owners who rent 2 or more unit buildings to have a lead test on record every 3 years, I believe, done by a properly certified person. And hopefully that will provide greater, again, proactive approach to limiting lead poisoning based on lead paint in particular. Some tightening up of tobacco and vape selling regulations like flavored vapes, things like that there have been some questions about and challenges. One that would be really beneficial that every local health department is going to be pleased about is changing the regulations for licensed home care service agency. Every local health department in the state is required to be LHCSA is the acronym, licensed home care. And what in the case of our health department, we utilize that when we do a maternal and child health visit or whenever one of our nurses crosses the threshold to someone's home. We don't do that like we once did under the other style of home care. It's called a certified. But we're still held to the same standard that agencies that do frequent and everyday home care, like with home health aid services or LPN services, things like that. And it's appropriately highly regulated. So the discussion is to change the requirements and really have a modified version for local health departments that do assessments of mothers and children, may do direct observation for mothers and children or for tuberculosis treatment and lead screening. So that's a very practical approach to what we do. So we're very hopeful that that will go through. And then there's some discussion about authorizing local health departments to be eligible for some Medicaid reimbursement services if that falls under the federal and state requirements for reimbursement. Again, that goes back to being able to bill a duty type of licensure you have, but that'll be interesting to see if that moves forward. And then a lot of discussion also on scope of practices for nurse practitioners, for physician assistants, for pharmacists, for EMS personnel to expand some of the authority that they'll have under their licensure. So all good things, I think, because it will just make healthcare a little more available to people and hopefully various cost-effective ways. So.
Hi, Patty has a question, Kathleen, so is Lydia.
It does behind.
Lydia, go first.
With the lead testing program, the free program that you're advertising, I see it all over the place. So I know you're actively trying to get that to happen. Our housing stock certainly indicates that we need to move that forward. What's the next step financially for if an individual or homeowner or a landlord with rentals find that there's lead that needs to be abated? Is there a financial next step in terms of assistance? Since the first step is free, what happens? I'm thinking especially for homeowners and in our older home stock who may not have the the resources, financial resources to abate the lead?
That's an excellent question, one that we've spoken about a lot. Eileen, do you feel good about speaking to some of that?
Would you require it without a child or?
Well, so we do offer this free inspections, and Elaine, if somebody is a grandparent, so they don't have a child living there, yes, we would offer it because the child does
Okay, but if
visit.
they're older without children, you're probably,
That would be a low priority.
yes,
you know,
okay,
yeah.
yeah.
So
Only
if
the
we
risk to
do
the
find
children.
some hazards and that they need to, repair them, and it's a homeowner, we would refer them to a home site, which home site has assisted homeowners before, and, fixing septic system roofs and, lead issues.
There's some, if it's not a big project currently within the grant funding that we receive, if it's a case of, I need to repaint these 3 door frames and really don't want to spend $100 on paint, that's going to be a hardship. We may be able to assist them through our grant funding. It depends, where we're at and what their circumstances are, but we definitely are trying to be creative in helping people meet the needs.
Well, I, as a legislator, am going to be a role model. I'm homeowner of an older home, and my home is frequently visited by, utilized by the grands in my life, grandnieces and nephews, and I am concerned. So I'll be calling to make that appointment.
That's great. They're a good group. They're very helpful.
Lydia, yes.
Thank you. As you know, I live in a district and represent a district of folks that are very high on this danger list of the lead issue. One of the things that you talked about is the lead certification for landlords. Mine is also a cost-related question. We know that not all landlords are rich, and also that the landlords who do see tenant situations as an investment, if there's an increase in cost, that cost trickles down to the tenants. So similar question to Heidi's, is this going to create a cost issue ultimately for the tenants? And if so, how can we help?
Eileen, I think you've been on some discussions with this.
Yeah, so this new proposal that was part of the governor's budget, they say money is going to be available for landlords to improve the housing stock if lead hazards are seen. We still don't know how much. It's probably not going to be enough, but they do say money is going to be made available to assist landlords.
Is the cost for the 3-year certification?
I don't know how they're going to, that again is up in the air in terms of if the landlord's going to have to pay for that inspection and how much is that going to cost? Or if they're going to provide more assistance to the local health departments and that we would do that inspection, that's still not, those details are not worked out.
Thank you.
Thank you. And to your point, Lydia, when you mentioned, we know neighborhoods, Cayuga County is one of 19 counties outside of New York City that's being looked at for this requirement for the first wave to institute it because of the age of our housing and the number of and severity of lead poisoning cases that we've had.
We hate to see that there's cost prohibitive things that will help our children to stay healthy. So thank you. Thank you.
Oh, Brian had a question.
Oh, yeah.
Do you have any, and if you don't have it, or if you have an estimate now of how many lead cases we might have had in our county?
I didn't write. Do you know that one off the top of your head at the moment?
Not that many in terms of the ones that environmental health's involved with. I just can't remember off the top of my head.
I've got the 2022, not 2022, we haven't done those yet, the 2021 statistics. And I can tell you who's being actively monitored, how many children are being actively monitored in the county. Our person who coordinates the lead program keeps.
I'd like to even know that. That's
Yeah.
a good, that's a good baseline, because I'm sure nothing's changed in a year.
Not
That's
huge numbers.
Yeah.
No, it has been great though, to the point we're trying to get the program out and known. We want to encourage people to make use of of these no-cost services and provide some incentive to do that. We're also linking in with programs like Head Start, and we've gone out there a couple of times and tested some of the preschool age children there and identify a couple cases. And then also we work with other programs. We had conversation with Christine and Jennifer from Social Services about ways we may collaborate further to assist clients. And so we're trying to your point, we don't want things to be prohibitive to people to engage to prevent poisoning.
Do you still track, I mean, the recommendation is universal screening at 1 and 2 for lead?
Yes.
Children, is that people are more compliant with that, physician practices?
Better, some better than others.
Yeah.
Yeah, there definitely was a drop off during the most intense years of COVID, and people are getting back on track with it.
Yeah, I'm just curious, is that testing a blood test?
It is. So the one that we do as a health department is called the Lead Care 2, and it's a finger prick. That's right away. You get results. If your finger prick results are over a certain amount, it's reported to your pediatrician or healthcare provider, who will then coordinate a venous test for very accurate reading.
Okay.
Thank you.
Thanks a lot, Kathleen. Great job.
Christine. Here. I was thinking, Christine, maybe we could put together HH 7, 8, 9, and 10. You explained to me HH 7 is to recognize the agreement that's been in force for your on-call services. And the other 3 are contract renewals. So if you want to just go through those. The first
Tell me the
4.
numbers again. 7 or the first one?
Yep.
7, 8, 9, and 10.
Yeah.
And then, yeah, so 7 is to enter into an agreement with Finger Lakes Business Services. They're the provider of our answering service after hours. So we have to have the ability to have people communicate with us on the weekends and outside of business hours at night, on holidays. And they've actually been a provider for us for many, many years. Recently, we had conversations with Shireen, and she asked us to actually do a resolution to formalize that agreement. Our costs with the answering service are about $12,000, almost $13,000 last year, and they've steadily been climbing. Not because the answering service has raised their rates, but because the frequency of calls that are coming in and the time that they spend tending to those calls has increased. So it's you can see on the resolution, it's based on the per minute cost. So what we're going to do is we're looking at, once the purchasing director is hired, we're going to be exploring an RFQ process where we can see if we can get a better rate and try to save a little bit of money. I don't know what that's going to amount to. If the rates seem pretty comparable just from us looking some stuff up online, with different providers, but for now, we are asking to continue to work with the Finger Lakes Business Service to provide the answering services, services for the department.
8 is a contract renewal with Cayuga Centers.
We're looking to renew our contract with Cayuga Centers for the 3 respite beds there. We have 3 respite beds that we utilize. We have access to those, all year long, every day of the year. And we are able to put children in there for alternatives to detention placements. We utilize it for respite, and we can utilize it for a group home placement if we need a longer term placement that goes above the 21-day respite cap. And HH9 is for us to enter into a contract, also a renewal of a contract with Cayuga Centers for the provision of supervision and monitoring services. This is a contract that we have with them for 3 full-time case managers that work with youth that are having trouble with behaviors in the community, at home, at school. They, see them in all different settings at the school, at home. And they vary in intensity as far as the frequency of contact with the children, but it is a home-based, outside and community-based intervention. The referrals come from either FAST or from the family court system. And
HH 10 is for us to enter into a contract with Elder Choice for the provision of personal care services. This is something that the contract that we've had also ongoing. It was a 5-year contract coming up for renewal. I checked in with our employee from the department that does this work, and she said that right now there's only actually two families that are two individuals that are getting services through Elder Choice. But we do need to renew that contract.
They have to have a contract in force, but there's no county money being passed to them. It's all
100%.
establishing them
Yep.
and Medicaid gets.
Medicaid, yep,
gets
Medicaid funds.
Yep, but it's the vendor that you have a contract with.
Yes, correct.
Can we get a motion and a second for HH 7, 8, 9, 10? No, can I ask some questions?
Second.
Yeah, second.
Okay.
I have a question. The climbing activity for social services, so what kind of calls come in during off business hours, if you don't mind my asking?
So the majority of the calls that come in are from the State Central Register, which is the clearinghouse for all the child protective services reports from the state. So when someone calls Albany and makes a hotline report to the State Central Register, they call the answering service. The answering service gets in touch with the department worker that's on call. So those are a lot of the calls that come in. We also have foster parents that call if something happens with a foster child after hours and they need to reach someone from the department. They reach out to let us know that if a child had to go to the hospital, for instance, because they were injured or were sick, they would give us a call through that. We get calls sometimes from the law enforcement agencies. If they're out in the field and they need to talk to us about a case, the communication runs through the answering service.
You have varying staff assigned to on-call responsibilities that change frequently, right?
We have casework staff and supervisory staff that are on call. And they varies by the day, like who's on. There's a schedule. They sign up for it and are on from, the off business hours.
Excellent, thank you.
You got a question, Heidi?
Yeah, on HH 10, how do these in the long care service, long care office administration of personal care aides, how do these consumers or clients differ from those in OFA? Is there, because I get the sense that this is.
These are the Medicaid clients.
Yep.
Okay.
These are the Medicaid clients. And I think that, well, maybe it's getting into more than we want to talk about, but there used to be more that came through Medicaid and that we did the assessment on and handled finding an aid service that would put the aids in the house. And since the state has taken over the initial assessments, we believe that they're really pushing more people towards that managed long-term care plans. And so they're going through Fidelis and Nescencia, I think is one of them. And then there's one more that I can't remember the name of. So the number of people that are actually getting the aid service through us has dropped.
Because they're enrolling in a managed care plan and then the managed care organization provides the service.
Through those other organizations.
Yeah.
So it's changing.
Yeah. That's why there's no aids for ISEP.
Right.
Yeah, right.
Right, probably.
Right.
And then all of these costs, I assume, and especially the renewals, right? Those are easy to find out what the costs are going to be this year when you're working on budgets, right? So this is all information, no surprises to the budget.
No surprises to the budget.
Thank you.
Okay, any more questions on HH 7, 8, 9, or 10?
If not, all in favor?
Aye.
Any opposed? And you want to go over the HH 11 and 12, those are filling of vacancies?
Yep, so 11 is a filling of a full-time caseworker position that is vacated and seeking permission to do that.
This broke your record, right? You were just.
Yes, yeah, we were full. I said that and it was like a couple days that I was able to say that we were actually full with caseworkers last Friday is when the caseworker left. So we're looking to fill that as soon as we can. And the HH 12 is for us to fill a transportation aid position that's a part-time budgeted position that we've had vacant for a little bit. Really hoping that we're going to have candidates taking this position. We have a lot of transport that happens for the foster children. It takes up a ton of time and having someone else that would be dedicated to being able to bring kids in for visits and help manage all the transportation that has to happen for them. It would be very beneficial and save the caseworkers a lot of time.
I'll make a motion to bundle 11 and 12.
Second,
I can pick up.
okay. Any questions on 11 and 12? Okay, all in favor?
Aye.
Aye.
Great about doing it, or I to approving.
Well, I thought once we bundle, it's then when you vote, it's an
Yeah.
approval.
That's what I thought, but.
Okay, just keeping them.
Keeping us honest. Do you have anything you want to add to your
No,
report?
just, my report, I mean, you can see from my report that our homeless, housing numbers are up. Not surprising with the winter. Hopefully we'll see a little bit of relief with that coming, with the warmer weather months coming up soon. I did put two, points of information in there about some stuff that's happening. With the SNAP program, the emergency allotment benefit that's going to be ending in February. We believe that that's going to be concerning for a lot of folks that have been receiving SNAP benefits. So, may get some calls from constituents concerned, that their SNAP benefits are going down. There is quite a bit of information being pushed out, so people aren't totally shocked and surprised when their benefits drop. But I do think it's going to put some pressure on the food pantries and folks just trying to make ends meet. The other point that I put in my report is about the work that we're doing with the Civil Service Department around trying to take advantage of this help program that the state is rolling out to help with hiring concerns and trying to make it more appealing for people to come in and take positions and not have to be taking a test and having a provisional appointment.
Civil service has to approve what titles that can work for, or you have to apply to have this particular title be exempt from the test and you can put someone in.
There was a lot of contingencies on what you have to demonstrate in order to have positions qualify.
Yep.
The only position that Cayuga County has for DSS, but DSS has that qualifies is the Human Services Examiner.
Because of the.
Well, because you have to have if there's a list and there's people on that list that's greater than the vacancies you have, doesn't qualify. Our caseworker positions are actually continuous recruitment, so that knocked them out of being able to be considered for this. You don't have to wait for a test. You come in and you immediately take a test.
The Human Service Examiner lists are not that great, and the vacancies are more.
And the
So
vacancies
it
are more.
qualified.
Well, and we, at this time, when we took a look at what we had for vacancies, we had 8 vacancies. And we had a list that wasn't even that long. So,
Great.
we
Yes,
qualified for that. And already we've seen some benefit because we've been able to publish on the civil service website that we are seeking approval for this help program and what that would mean. And we've seen a ton of people apply.
Because they don't want to deal with the exam and what if.
Taking a provisional appointment and maybe passing, maybe being reachable,
Yeah.
So I think that this is a very, very measure,
Hey, did you have?
Yeah, just another comment. About 2 months ago, I received an email from the superintendent of Auburn Schools, Jeff. I think everybody knows Jeff, about an incident at school, some incidents at school. So I met with Elaine and Chris and some of her staff, Jen, Sherry. We all met as a group and decided that we would meet with Auburn, the superintendent, and some of his high staff and go over what we can do to help each other for these kids, these truant kids. And we've had 2 meetings together with the schools, and I think it's worked out great. I just want to thank you and your staff for doing that. I think we've made a lot of communication that wasn't there before. We know what they're doing, they know what we're doing, and we're working together for these kids. And I think it's great. I want to thank you for that.
I had a constituent contact me through social media saying that a friend of his, et cetera, he was reaching out for support, found out that her housing subsidy was going to be cut in half within like 1 month with very little notice. Is that anything you know about? And
No, I don't know that particular person's situation. There's no sweeping event that's happening. where
okay, so there's
people's,
there's no reform, there's no
No.
like there is with SNAP.
So
Okay.
it had to, my suspicion is that it had to have been something specific to that particular person's case or situation.
Okay. Okay.
Just quickly, then we'll go to Lauren. I am going to be sending, and I've sent it to Christina and Jim Basile and Bob Shea. We're on the little ARPA committee, thanks to Dave. And there is going to be, I've been contacted by Sherry Weiss, who's the executive director of the Cayuga Community Health Network. And she's basically looking to see if there is any interest in the county looking at appropriating $60,000 of ARPA funds that would be matching what the city of Auburn is putting forward to continue a homeless outreach and advocacy program. She wrote up the proposal. It's not that long. They've been in business, I think, since October of 21. She has the types of clients that they've served. She serves through this case manager, people that are at risk of homelessness and those that are homeless. I did talk with Mary Riff when I saw her on the elevator and asked her in her mind if this was, a worthwhile program from the department's point of view. And, she certainly seems to think that it is. And, when you're looking at, and I know 103 homeless individuals that we're housing right now, and it is code blue. So some of those costs for sanctioned people are covered, but this is a huge expense, especially in the winter. And it's one that we're bearing and budgeting for. And, I think everyone will agree, using hotels is not the ideal. So we've got the New Visions program looking at expanding on Grant Ave for a homeless shelter, which it would be good. And then we have, any advocacy and any work with people that we can do to get them out of those hotels or prevent them from getting in. So I'm going to be sending that proposal after I get some feedback from this little ARPA committee to people to take a look at. And, if Dave would allow, we could have Sherry come in and discuss it. We did talk months ago about, they were a big ARPA award, 500,000 for all the not-for-profits. That, that has not moved forward, and I don't see that coming. But this is a specific individual community-based agency request to keep a program that I think will have, real impact to us. So I just want to say that, especially when you're looking at these kind of numbers for emergency housing.
More help, the better.
And I just want to add regarding that potential proposal, the only social welfare monies that we put forward with ARPA so far are with our youth bureau. Otherwise, all of our ARPA monies have gone into infrastructure, equipment, et cetera. So I think that this is a good move to put some more money into social initiatives from ARPA.
Lauren. Okay. You have now 3 resolutions with HH 16 being pulled, so. Huh?
I think.
Oh,
There's
then-
19.
Sorry, okay. All right, you want to go through HH? We'll go through them all and then we can ask questions.
Yeah, so the first one is contract renewals for state aid funding, to renew those contracts with the same agencies that we were contracting with before. That would be, I don't have it in front of me, but it's Cayuga Centers and
Liberty Resources.
yes, and Liberty Resources. So that's for the adult crisis respite, as well as Cayuga Centers provides some of the FAST services, so safe care and functional family therapy.
HH 14, you're asking, similar to what you did with the staff social worker, to extend a resolution allowing the fill of a health home care manager
So the time frame ran up. We still haven't filled the position, so we're looking to extend that.
Okay. Then if you want to talk a little bit about the mental health opioid settlement fund contract, this is the.
Yeah, so the Community Services Board has been meeting. We determined that we were going to issue a request for proposals for the opioid settlement funds that you all had gave us all of the funds, the unrestricted and restricted funds that came to the county through those settlements to be able to use for those approved uses, which is really putting the money back in for treatment and services. So we issued that and we received 13 proposals. Community Services Board has opted to move forward on 4 of those. One of those is to continue the work at the county with the work that we've done with the Healing Community Study and to expand that further. So that's offset by the new grant that we got. So it's kind of covering half of the services. Well, I say actually covering the existing services we had, and then the new grant is covering the expansion of those services. Each of these projects were $75,000 projects, except for Nick's Ride has two projects we will be funding. One of them is $75,000, which will be embedding a pier into the ER and the behavioral health unit at the hospital to be able to connect those people with services upon discharge from there. And then the $20,000 proposal is what's called the Breaking Barriers Fund that Healing Community Studies was funding before, which is really anything that is a barrier for someone to get in treatment, they will use that money to pay for. So it's anything from a cell phone, a couple nights stay in a hotel that they can stay there before they go in, 2 days before they have a bed in a rehab. It's a lot of really creative things. We paid for plane tickets before for people that have gone to rehab outside of the state. So really any way that we can break down the barriers to getting people in treatment. And then the other project is CHAD, which is $75,000, which is really to expand their prevention. So that's they really want to get into all of the school districts in the county, and they really need the funding to be able to fund a position to coordinate all of that on top of the state aid they receive. So they've already, substance use prevention with our youth. So we're really excited about all those projects. So this resolution is to enter into those contracts for that funding.
Okay, and your last resolution that I forgot, 19.
Okay, so this is similar to one that I think Kathleen had. So we have a staff social worker that is retiring. Her last day of work is going to be the last day of March. We think that we have a candidate for a social work position, so we would like to be able to hire for that position prior to her retirement date, which would be the first week in May. Just because we've had such a hard time hiring a social worker, we have one hired for to be able to do the mobile crisis program. We just need to hire a case manager, but this is the other position to backfill hers.
And I got the clarification from Lauren. The person that's retiring, her last day on the job is March 31st. But because she has time to approve to burn, she'll be on payroll through May 9th.
May 9th.
Okay. She'd like to fill the position right after March 31st so that they don't have to wait 6 weeks with no one.
And not to mention.
And to assume the caseload.
She's got a lot of cases that have to be transferred as well.
Lauren, will she be able to save that time that she's earned?
She'll get paid out.
Yeah, she'll get, yep.
Okay,
yep.
great. Thank you.
And then just a heads up, we will be coming back. We have a part-time therapist position in our budget that she will be coming back after she retires into a part-time.
So you'll have a request to fill a part-time
Yes,
vacancy.
so that will be coming up next month.
Okay.
I'll make a motion to bundle 13, 14, 15, and 19.
Nightingale, second bundle.
Questions on any of those resolutions?
I did have one question. I'm looking for it.
Make a comment while she's looking for that. Thank you for putting things together, answering my questions so that I don't have to ask them.
I like that too.
No, that she put the budget information included in there, so we don't have to ask those questions. Thank you.
I'd like to say, great job. This is like proactive. And I'm really proud of you with the conversations you're having. I just need it.
Well, she's looking for a question. If you could, we went to a Healing Communities meeting the other day, and I thought it was interesting with PBS.
Yeah, so I do have some updates.
That's
I do have
really,
that on my
we
list.
hear this, yeah.
But
Heidi,
do you want to ask a question first?
On HH 14, it's this authorization to amend the resolution to extend your authorization to fill position of health home care manager. However, under one, two, under the first resolved, the position title is titled in the resolution as Crisis Intervention Care Manager.
Okay, so that was
Is that, I think that needs to be amended.
Do you have?
If
I
you're
have
ready.
it right
Let
here.
me just look at the,
All right, which it is HH what, Heidi?
14.
14.
is that under the first resolve?
Under the first resolved, it's referring to the position as Crisis Intervention Care Manager, although the resolution is for the fill of a health home care manager.
I think we should blame Rich.
Yeah, that's,
Yeah.
that's good, that's good.
Why would you want to do that?
Yeah, so it looks like that would need to be,
Amended to say health home care manager.
yes. It would need to be health home care manager under that.
And the
Very good,
position
Heidi. Very good.
control number stays the same, right? 715.
Yes, because it refers to that in another paragraph as well, the position control number.
Who would make the amendment?
Well, it's on the table now, so you can make it here.
Okay, then I move to amend that resolution to have it read health home care manager in the second, or the first resolve.
First resolve by second.
All in favor?
Aye.
Aye.
Hi.
Great, that's great. And then it'll
Now you gotta vote.
magically happen.
Move it as amended.
Yeah, we'll go forward as amended.
Okay, all right, great.
Full Edge gets it correct.
Okay, great. Thank you.
You know you're reading it,
Hi,
Heidi. You know
Heidi.
you're reading.
Oh, I read the packets thoroughly.
Yes.
See my
Good job.
markers, like the highlighter.
Okay, so I do have a few updates.
Okay.
Oh, wait, don't we need to vote on the?
Yes, Lydia said.
Okay.
that. I didn't.
Somebody.
Has a-
Resolution as amended. Can I get a motion for the resolution as amended?
breakout session someplace.
Aye.
Second.
All in favor?
Aye.
Hi.
Okay. Okay, all right.
So I just want to give some updates on the Department of Justice that I was just referring to before about the expansion of the work that the Healing Community Study has done. So there's quite a few like small projects that are happening with that at all different intersections of the justice system. So there's some pretty cool things happening. I just kind of wanted to update you all on that. There's work groups that are meeting bi-weekly with all different, partners involved in that. So they're going to be embedding a peer in CPS in foster care. So a female peer from Nick's Ride will be working with families and obviously to prevent their children going into the system and working with those families to keep the children at home with them, and somebody who has had lived experience with that system as well as substance use and mental health as well. We're working with 911 and all law enforcement agencies, as well as Liberty Resources, who we contract with for mobile crisis, on really about diverting. We're trying to figure out a process of 911 not needing to necessarily deploy law enforcement on all of the calls that really are mental health calls. So trying to get mobile crisis to respond directly to those calls, or co-responding if it rises to the level of needing law enforcement there. So really trying to free them up and get the appropriate people on those calls, which are the mental health professionals. So we've had some work groups around that. We're expanding the Narcan program into more rural areas of the county. And there's some challenging things that have come up with that, but I think, we're gonna keep working at that, as well as a lot of the work is around first responders. So there are a lot of volunteer fire departments in this county that just do not carry Narcan at all.
Don't want to either.
And don't want to. So yes, we are working to change that stigma. Yes.
So, are you saying that they are refused, like they don't want to carry it, or they don't have access to carry it? But that's a big difference, because
So I-
they're tasked with saving lives, so
So I'm going to say that it's probably both, but we've definitely heard some people outwardly say, I don't believe in that. I don't want to carry that, which is a problem that we're working on. Yes.
I think that this is my opinion, I don't know if this is a possibility, but shouldn't be mandated to carry those type of supplies. I mean, when there's certain things you're mandated to have in your possession, shouldn't that be one of them?
I would agree with that.
I mean, mandated by the
The
state.
state,
at this point-
we can let it, but even though, if you're volunteering and you're refusing to carry Narcan, and you're there to save lives, to me, that's very disturbing.
It is.
I mean, there's no getting around that. And perhaps that person should not possibly be first responder. I mean, if you're refusing to carry something.
When you're done.
I'm done.
If there's anything that can be done in my district to maybe go out with you folks to talk to these folks and encourage it, I welcome the opportunity and I appreciate the opportunity.
Thank you. Yeah, I think we've bounced around some ideas of, you know, I think sometimes hearing it from a peer, so maybe another first responder that, you know, has had some experiences with using Narcan and saving people's lives, maybe they can start to change the stigma with some of those other first responders. So we definitely have a plan. And I think it's something we just have to keep working on, but obviously stigma is a huge part of this, so, but I agree.
And Lauren, one other thing, maybe if we can convince them to utilize these things without a mandate, this will, you know, maybe with letting them know that if there is a mandate, then maybe that makes more training that they'll have to go to. Maybe they'll be more willing to do it voluntarily.
And then the other part of that is embedding peers in Auburn Intervention Court and really trying to get people referred to the opioid court so that they're more steered towards treatment versus jail. So that's another piece of that. Any questions on that?
I do. I have a question. Is this, is there something, obviously, Lydia brought up, is there any way you could work with some of our county legislators if they're in support of Narcan? Perhaps those are the conversations that they can initiate, because to me, that's terrible. Because I mean, I'm in shock.
I am
this
too a
is
little bit,
shocking.
yeah.
It's like, you know, saying that like you're not bringing your first aid kit when you come out because you don't believe in the first aid. This is not anything to be talked about.
Right, and we do know that in those parts of the county, it takes a lot longer for law enforcement or for even first responders to even get there. So that's why there's such a push to push Narcan out to even people, bystanders, to be able to use that, especially, you know, if that is the case, when it takes so long for them to get there and they don't even have the Narcan with them. So we're really trying to, you know, do our best to get it out there as much as we possibly can.
I also don't see any easy access points. I saw some in the city, right, where you can grab an Narcan. I don't see any of those out in my rural area.
Okay. Yeah, I know there's some in, we're trying to do our best to spread it out, but yeah, I could definitely have, you know, Wally does our Narcan program. So
And there is an outreach. There's a real attempt to get to the volunteer services out in the county and offer the training and give them the free Narcan.
Yeah.
That's how this is all being uncovered.
Yes.
Like some shouldn't be an issue of we can't afford it.
But I know that Wally took this project.
Yes.
And has went throughout the whole county and educated. I would say this, and I mean, I'm a fan of Wally, so I'm a little biased, but I do know that he is educating people with Narcan in this community.
Oh, absolutely.
So I do know that the first responders, volunteers, that was his stop. I know he stopped by there, and to hear that they don't want to do it is totally disturbing to me. And we lose people because we don't have Narcan. So I don't understand why this is like.
People are zeroing in on where there seems to be stigma and resistance and coming up with strategies to overcome those. That's really what.
And this is, to me, and I'm gonna go on a limb. I don't even think this is a lack of education. This is lack of just willingly being ignorant. Because if somebody is dying and you don't have the tools to help them, I mean, this is not. I don't think there's enough education for a firefighter who's already have a medical background, a background of saving lives, to just ignore the fact that there's Narcan available and you refuse to use it because of your own personal beliefs. I think that's deeper than education. I think that's more.
Yeah, I think it just goes back to the mindset of different people naturally. There's liability questions. There's each town, each fire company has an attorney. Again, I don't know if liability is playing anything to do with anything to do with this, but it is a mindset, and slowly but surely, I think we are changing people's minds. It will take a while. I don't think it'll ever be mandated by the state. I just don't think it will be because of liability. But it's a mindset that we've got to do a little bit at a time. And we've come a long ways in the last 2 years. This county's coming
Yeah,
awful
and
long ways.
I would say I don't know that it's an issue of liability because using Narcan can't hurt anybody. Like even if I wasn't.
And there's the Good Samaritan law.
Yes.
That
So,
protects people.
yes. So I'm not sure if that's it, or I think it's stigma. I think people have an idea that people who use substances chose to do that, and I think they
I
just
think
have
you're right.
different ideas about it. So hopefully we can keep working at it and change that viewpoint. So
Heidi, did you have something?
Got a question about the, you mentioned the intervention courts and embedding peers in them. I just want to be sure I know which courts. That's the Auburn Drug and Alcohol Treatment Court and then the newer opiate court.
And part of that is having an outreach person that's going to go all to the town and villages and educate them about referring to these courts as well. Because I think sometimes if you don't hear about it, you forget about it, so it's a real effort to remind them about that this exists and this can help a lot of people get treatment versus, jail time. Okay. The other thing that related to that is, yes, PBS did come to Cayuga County and interview our staff related to our response to the opioid crisis. They went to the jail, they interviewed the sheriff, they came to mental health, interviewed Monica. They went to Nick's Ride and they interviewed a bunch of people in our community. And I will say they were very impressed with the efforts that we have made here and how far we've come. So that's positive news that there's some recognition, and that's nationally. So it was really cool.
It's going to be televised.
It is going to be televised, I believe, in the beginning of March. So I will be sure to let all of you know when that happens as well. So that's really
Is that
exciting.
part of their point of view program or the front line?
I can't remember, but it is it was an effort to look at rural communities and see how they were
Right.
responding to that. So
But PBS has two, if you said it's national, it'll probably be put the point of view or front line.
yeah, so I will make sure whenever I hear that that's going to be live that you guys, and there will be a link too. So I will make sure I get that out to everybody.
Congratulations.
Yes. Well, it's everyone else that was doing a lot of the hard work. So I'll be sure I'll let them know. The other thing is we're really working with the sheriff on the mental health in the jail right now. So you may be hearing about this at his committee meeting, if any of you attend that as well. We have mental health provides one full-time social worker, clinical social worker to the jail, as well as our prescribers provide the psychiatric care for the mental health at the jail. It seems to be with changes in legislation that there is way more work than our one social worker can handle or even think to do at the jail. There's been some recent grievances that have been accepted by the state related to that. So I'm just throwing that out there that
Grievances by the inmates that say I've
asked for mental health.
I
can't get it. With the HALT Act, there's requirements to be seeing individuals every single day. And if they're a certain age and they're the vulnerable population, they have to meet with more frequently. So the social worker out there is very overwhelmed and has been for quite some
So
time.
it has to be a mental health professional that does the evaluation of a HALT.
Yes, because, and you're also, if anybody's locked in, they're doing evaluations on whether that person needs to remain locked in or not. So doing those clinical assessments as well. So I'm just informing you all that that is a need at the jail. Not sure what that's going to look like or how we're going to, plan around that. But I know my one social worker there is very overwhelmed and there's a ton of work to do there with the changes and things. So
Do you see any grants coming down the line?
that is something we always look for. There's some different ideas about different money that we could probably potentially use, but I think we're just the two of us are gonna problem solve and figure out how to best fill that
And
gap.
if there's potential opioid funds that could offset some of that, you're gonna look at that. So it's, because Lauren and I were talking that all of the mental health services that are in the jail are outside of the clinic operation and they have their own budget line. So they would end up being an expense to the sheriff's department if they weren't provided directly by the mental health department.
And that's in our budget, separated
Out of the clinic. So you'd hate to say her, she's not meeting her clinic revenue when she is actually meeting the requirements. But from Lauren's point of view, and I agree, we're all in this together. So if the sheriff has the obligation to meet the mental health needs of their clients, they're, you're supporting that through staff that you hire and that you send over there, but that is outside of your own mental health clinic.
Yeah, hopefully we will have grants writer, grants director very, very soon. It's coming. There's interviews going on now.
Oh, there are applicants nowadays?
Yes, and we have one tremendous applicant. So hopefully that'll be filled very soon. And that may be the first job of this person, to start working with grants with all our different departments naturally.
Great,
So just keep that in mind because there's help coming.
very good. And then I have one last thing. We have some flexible training money in our budget. We are working on training 2 therapy dogs for the mental health clinic. So kind of a creative thing, but it has so many benefits to both our staff and our clients that we're really looking forward to that. I know I've talked to Lynn a little bit about it, and then I wanted to let all of you know here too as well.
Do you think that 66 training money could be?
I did ask. If not, we do have.
Train the dog?
I did ask OMH, so we will see what OMH says, but either way, we do have some training money in our budget that we can use for that if we, and we can use the other for other training, so.
And one of those doggies is yours.
It is. You passed the test, I guess, so. Let's see. I'm sure there's a lot of work for me to do as well.
Congratulations.
Thank you.
Thanks.
Questions?
Thank you, Lauren.
Yeah, no
Thank you.
problem.
Good
Thank you.
Anything else? Entertain a motion to adjourn. So.
Sure thing, Madam Chair.
Hey. All right.
Great meeting, everybody. Thank you.
Second.
Those are-